This is a News 3 Now special presentation. Madison's Top Nurses 2020.
These are the faces of the heroes on the front lines this year, and we're honoring them tonight. Appropriately, this year, 2020, was designated by the World Health Organization and the World Health Assembly as the Year of the Nurse. Hello, everyone. I'm Susan Simon. Every nurse in our community went above and beyond their call of duty this year. And Madison Magazine is highlighting the top nurses providing care to those in need in a cover story called The Lionhearts, featuring nurses nominated by their peers, healthcare leaders, and community members. Tonight, we'll recognize winners in 3 categories: innovation, practice, and leadership. And with 60 nominees, all worthy of the award, they were difficult choices to make. We begin with one of the winners in the Innovation Award. Here's Chris Stanford.
Defined as a new idea, method, or device. The high stakes of the pandemic have inspired some to rise to take on unprecedented challenges. That's certainly true for the 2 accomplished women you're about to meet. They pivoted on a dime, essentially putting their professional lives on hold because they had an idea. They learned new methods, and they knew the devices that would make a difference.
It may not look like much, but the work happening in this trailer is quite incredible. It's here 2 women built a bridge between 2 groups of people that were separated by the dangers of COVID-19.
There was a problem I knew how to solve.
The problem was at Dane County's homeless shelters. When the pandemic was taking off, shelters needed nurses to screen their guests. The alternatives, another night on the streets or risk spreading the virus. That's where the bridge comes in. Let's call Bree Laughlin and Tracy Zvenich the architects. With nearly 4 decades of nursing between these friends, they refocused their experience and started Nurse Disrupted. The technological link they created connects nurses and guests at local shelters.
I knew how to do it with technology and nursing, and I couldn't think at that point of not doing it when I could see such a clear path and solution.
Their idea was to take the complexity out of the technology so nurses could screen patients through an iPad.
At the shelter, there's a tablet on a stick at the location. You touch the tablet, on the other end is our nurse or nursing student who's ready to observe, educate, and screen.
Though simple, it worked.
Our COVID-19 screening program have helped the shelters remain outbreak-free for over 6 months into this pandemic. They've done a great job with the safety precautions and screening each and every shelter guest every day as they come into shelter.
Bree and Tracy made another connection, too. Nursing students were having a tough time finding opportunities to get hands-on experience. Nurse Disrupted bridged that gap as well.
We have been able to collaborate with 4 schools of nursing in Wisconsin and supported over 550 nursing student hours. At the beginning of the pandemic, schools of nursing saw clinical site closures or reduction in the hours that they were allowed to be on site. So we have been serving as a virtual clinical site for schools of nursing and the nursing students to be able to get the hours that they need for graduation requirements.
Like any good bridge, Bree and Tracy's now has a solid foundation, and with enough support, can solve other problems as well.
Our populations in the homeless shelters, they had chronic disease and mental health crisis issues well before this pandemic. Now that we have them wired with the technology and the pipeline for nursing and nursing students, we have a real opportunity to deliver this care post-pandemic.
So far, Nurse Disrupted has performed more than 8,000 screenings. Congratulations, ladies. Keep up the good work. Mark Kane is here now with the other honoree in the innovation category.
Well, most of us remember how sudden the COVID-19 pandemic felt, and UW nurse Brittany Nesbitt is no exception. Friday the 13th, back in March of this year, is a day she'll never forget.
And actually, it was Friday, March 13th. We were all standing at the Digestive Health Center talking about how COVID-19 was going to essentially impact us. And on Sunday, March 15th, we all got a call from our manager saying that the Digestive Health Clinic would actually be shut down, and we were to report here to learn how to test employees for COVID-19.
Here is a tent UW Health set up in Middleton, the COVID tent they called it, to test people for the coronavirus. At first, there were a lot of questions and a lot of fear.
I think that in the country in general, in March, we didn't know a lot about this virus, and so being from an outpatient setting at the Digestive Health Clinic to all of a sudden you're on the front lines, we were all a little taken by surprise, and yeah, there was a lot of fear, a lot of tears, a lot of scared.
And a lot of adjusting and a lot of precautions.
So as nurses and techs, especially at the Digestive Health Center, we're very used to wearing PPE. We wear PPE in all of our procedures. However, when we reported here, the PPE that they had for us was actually leftover PPE from Ebola.
But this was COVID, and extra precautions had to be taken. Nurses and techs in the tent were told they'd be wearing a full hazmat suit. It's called full Tyvek. It's not something most nurses usually wear. Fortunately, Brittany has experience wearing Tyvek at a previous job working with the smallpox vaccination.
When this all came about and everyone was really scared and didn't really know how to put it on, how to take it off, I really jumped in and kind of showed people, like, it's okay. There's a way to do this. It's not as hard as it looks. And all of the staff was really receptive and jumped right in. I think the first time we actually stepped foot in the tent, we had like 12 to 15 people that jumped to the occasion and came out here to swab the first few patients.
And lead she did through some very uncertain and challenging times. Brittany learned you just have to go with the flow.
I think that healthcare in general makes you predisposed to being able to make those adjustments at a really quick pace. And I think that we had a really amazing team that was willing to switch at the drop of a hat. And all of the team members just rolled with it. Every punch that we took, every kick that they took, the heaters are out, the air conditioning is out, we've had power go out, we've had all those things. And the team was really just great about rolling with all of those things. There's a really team atmosphere here that's really awesome to be a part of. Although it's something I never wanted to be a part of, I'm very grateful for the experience and the teamwork that I felt in this tent.
This all started in the cold of early spring, and now the cold has returned, and Brittany and her team know the work is far from over.
It's not warm out here. This isn't easy work. We will show up here every day of every week until we don't have to anymore. And if the only thing you do for us is wear your mask and stay apart and socially distance, that would be awesome.
Since the COVID tent in Middleton closed for the winter, Brittany returned to the Digestive Health Center. She's also helping out at the UW's new testing site on John Wall Drive on the east side. Brittany has recently accepted a position with the Clinical Staff Education Team. She was so impressed with all of their education efforts related to COVID, she'll be starting her new role in the middle of January. So she'll continue to be a leader in the fight against COVID. Mark Kane, News 3 Now.
When we come back, we'll have profiles of two nurses who are being honored for practicing the skills that played a vital role in helping patients in COVID wards. As Top Nurses 2020 continues.
Only Steinhoffel sells more Tempur-Pedic than anyone else. And right now, get $300 in Steinhoffel's cash with any Tempur-Pedic. We are Wisconsin's #1 Tempur-Pedic retailer.
Medical bills, missed time at work, life-changing injuries, household expenses. When you're the victim of an accident, it can feel like the weight of the entire world is on your shoulders. But we've dedicated our personal injury law firm to help take this crippling burden off your back. Havish, Habish & Rotier. We fight for what's right.
We're called Firstborn Weather for a reason.
Our Firstborn Weather team has been bracing us for this snow chance now for the past 10 days.
And when the winter storm hit,
this has been the zone that's likely to get the heaviest snow.
Our team kept you informed with the area's best coverage. Trust the Firstborn Weather team on News 3 Now. Channel 3000 Plus. Watch from your streaming media player or mobile device.
Tonight, we're honoring nurses in our community named in Madison Magazine's Top Nurse Awards. The next category, the Practice Award, goes to two outstanding nurses working in COVID units. Here's our Josh Spreiter with the first.
It's been a tough year for those on the front lines of the COVID-19 pandemic. We caught up with Madison nurse Anika Scott, who's helping others survive these times through authenticity.
my parents did really well with instilling values in us, the importance of hard work, of good work ethics and discipline in working towards our dreams and our goals in life.
Scott is the only black nurse on her unit in a state where only 2% of nurses are black.
Being part of such a small minority of nurses, it is eye-opening. I am one of very few black nurses at UW Health.
Her story doesn't begin here in Madison, though. She grew up in the Caribbean and later moved to do missionary work and teach English in Mexico, where she earned a degree in management and communication studies. Next, she went to Haiti, where she earned her master's degree in public health administration while working as the director of education and training at a hospital. That's when she realized she wanted to do more, give more, and experience more.
I felt like I was missing something in that direct patient care.
When she came to the United States, her husband began teaching at Beloit College, just as the UW-Madison School of Nursing was launching its accelerated 12-month nursing program. Soon after her 22-week orientation at UW Hospital, COVID-19 hit. But her life experiences prepared her for this moment.
I think so. It helps with the way I approach my patients, the way I speak with my patients. I think that I'm able to think beyond what I see in front of me and treat with them on that level, meet them where they are, but help them to take an additional step.
She certainly never predicted that a pandemic would strike and she'd find herself serving UW Hospital's most acute patients, all in her first year on the job.
When I think of COVID and the way that it is affecting everyone, but particularly the black community, it is something that is heartbreaking in the sense that black people have so much to put up with and have had to put up with so much in life.
Now she opts to wear a hooded battery-operated respirator with a clear face shield. Even though it requires extra time and care to gear up and down and clean between patients, she says it's more personal.
I prefer to use the PAPR, which is a clear shield. It allows patients to see my face. It allows them to see my smile, to see my concern.
This is especially important for hard of hearing and patients of color who are comforted by a provider who looks like them, as well as Spanish speakers, as Scott is fluent.
I felt like nursing combined with my former public health experience complemented each other in a really special way, in that I can see my patients at the bedside now.
Scott likes to treat her patients like family because she knows how important family is. 2 of her 5 sisters are also nurses.
Sadly, my dad died 17 years ago, so he's not able to see how far we've come. But my mom is really proud of all of her girls.
She's grateful to have a husband who's always supportive of whatever she sets out to do.
I think that's what family is about, supporting each other and working together to help each other achieve your goals and your aspirations.
And while Scott is honored to be called a top nurse, her focus remains on the community as she encourages people to not be complacent at this time.
We have been dealing with COVID for almost all of 2020, and it seems like we will continue to deal with it for who knows how long. But it is important to continue with the guidelines that we are being given, and it is also important to take care of ourselves, not just physically, but emotionally and mentally.
Anika Scott would also like to thank other members of her healthcare team, many of whom nominated her for this award. She says oftentimes it's only the doctors and nurses receiving all of the credit, when there are so many people behind the scenes that deserve just as much thanks. And with another honoree in the practice category, here's Leah Linscheid.
Stories of compassion within the healthcare community aren't hard to find, but one nurse practitioner at the William S. Middleton Memorial Veterans Hospital, Rachel Ruland, shows us how she became like family for people going through their hardest times.
For most of us, a hospital feels anything like home. We're used to touching our patients. We're used to being very close.
That's not how nurse practitioner Rachel Ruland feels, though.
We're used to being really nurturing, compassionate people, touching our family, you know, hugging. Things like this don't occur anymore. And
family is how Rachel considers her coworkers at the VA hospital. And like most of us, Rachel would do anything for family.
It's heartbreaking for nursing.
So when the COVID-19 pandemic first hit, she requested a transfer to the VA's intensive care unit to help prepare for a potential surge. She was asked to create a role for nurse practitioners, not normally found in ICU settings. But her managers say she went above and beyond, extending that sense of family to include loved ones not allowed inside hospital walls.
My role is, the sad part about COVID is that patients' family members can't be here and can't see what their loved one is experiencing. We were doing a lot of iPad communication with families, having meetings where we were updating families about their loved one's care, trying to kind of keep them in the loop despite the fact that they're not able to be there with their loved one, which has been the most challenging part of this.
That's not where Rachel's hospitality ends. In late March, she volunteered to transfer to hard-hit Chicago, moving with just a day's notice to the VA hospital there to work 12-hour ICU shifts. There, case numbers were high, and patients often only had nurses to turn to for comfort.
You really develop a unique connection with somebody through this experience. It's really hard to describe. It's just, it's a feeling, it's a feeling that you're really helping somebody.
You might wonder what pushes Rachel to go above and beyond. Just before the pandemic, grief really hit home.
At that time, my father was in hospice, and we were kind of caring for him, and basically, I really had a strong, basically a calling to kind of help on a bigger picture, and kind of help patients who maybe were experiencing somewhat of a moral distress situation that was happening in my own life, I guess.
It's that experience with her own father that has expanded Rachel's sense of family to encompass so many across the Midwest, from Madison to Chicago and back. And as the pandemic shows no signs of slowing down, she has a message for her healthcare community.
I would probably make a shout out to all my fellow nurses. Just caring for patients all over Wisconsin, just to stay strong, stay healthy, know that their work is appreciated more than they probably know it is.
And that sentiment of teamwork is heard from all of the nominees. For News 3 Now, I'm Leah Lynchide.
We'll get to the next category, the Leadership Award, when our special Top Nurses 2020 continues.
Menards carries the products you use every day. Everyone needs a battery they can rely on. So choose Energizer batteries and products. Energizer Max batteries are designed to hold power for up to 10 years, so you can be confident you'll always have power when you need it most. Grab a 16-pack of Energizer AA or AAA alkaline batteries for only $7.99 each now at Menards. Plus, give the perfect gift with a Menards gift card.
More season's greetings to you all from Menards.
Have you heard? Tempur-Pedic sleep is better sleep.
With innovative memory foam developed by NASA, Tempur-Pedic mattresses reduce motion transfer,
which means less tossing and turning so you can sleep undisturbed through the night. But which Tempur-Pedic is right for you? Come to Denver Mattress and test for yourself. Let our expert sales staff guide you to your perfect Tempur-Pedic. And right now, get a free Furniture Row gift certificate when you purchase any Tempur-Pedic. Shop Denver Mattress today, your Tempur-Pedic elite retailer.
Tonight, we're honoring nurses in our community named in Madison Magazine's Top Nurses Awards. The next two winners used their experience and good judgment to be honored for their leadership. We begin with Eric Franke.
While the pandemic has been something never before experienced by our healthcare providers, they planned for it, and they were prepared, and no plan can be effective without good leadership. At Unity Point Health Meriter, they had just the person, Nathan Bubenzer, to guide them through a year like no other.
It's not a matter of if, it's a matter of when.
When you're dealing with a deadly pandemic,
but we didn't know exactly what it would be. Most people thought it would be some sort of an influenza.
You want someone to lead your healthcare team who has been through a little bit of everything.
The way I describe my department, my emergency preparedness department, it's a department of one that has a staff of about 4,000.
Unity Point Health Meritor's Emergency Preparedness Safety Manager is Nathan Bubenzer for the emergency that won't end.
Most of the time, the emergencies are a day, 2 days, maybe a week is a long emergency. We've been operating under an incident command system and our emergency operations plan since February 5th.
A former ICU nurse and infection preventionist, his leadership and expertise has helped more than 110 hospitalized COVID-19 patients leave Meritor and return home. From Meritor's Incident Command, Bubenzer's deep knowledge of public health and communication skills have been vital.
How many COVID patients do we have currently? How many open beds do we have? How many of those are in the ICU? How many ventilators are we using right now, and how many of those ventilators are being used on COVID-positive patients?
And as the numbers climb and the pandemic stretches into the winter months, he sees the impact it's having on his team.
We're human, and we're tired, quite honestly. Those are the two things that run through everything that we do right now. So whatever patience and understanding we can ask for from the public is greatly appreciated.
He says they're the ones who make his plans happen.
So I'm responsible for all of the emergency preparedness things that go on, drills, plans, exercises, responses. But I can't do it without the support of everyone that's here at the hospital.
Even in this unthinkable healthcare challenge of 2020, the goal remains the same.
We're doing everything we can to make sure that you, your loved ones, get the care that they need throughout this pandemic, whether it's COVID-related care or non-COVID-related care.
Nathan is also appreciated by those who nominated him for his sense of humor through all this. Known for his deadpan delivery of jokes and his team of crisis training helpers, which includes a disaster chicken, a troll, and a trio of skeletons, all named Bert. Charlotte DeLeste has a profile of the other honoree in the leadership category.
It goes without saying, nurses are critical. They are there for us during some of the most intimate moments of our lives. For example, the birth of a baby, and even the passing of a loved one. Ryan Klostermeyer is a nurse who works with Heartland Hospice, and he's making sure the people who are getting ready to transition won't be alone, even in a pandemic. To genuinely support someone and their family through the end of life's process is not something that can or should be done remotely, even during COVID.
And instead of running away from that, we leaned into it and made sure that we were a resource available to them and their family to meet their needs, pandemic or no pandemic.
Ryan Klostermeyer is the administrator at Heartland Hospice, which doesn't have a dedicated care facility. They bring their TLC to their patients.
Working as a nurse with a hospice organization is different from working in the hospital setting in the fact that we provide care wherever an individual calls home.
And as you can imagine, during this pandemic, providing that exceptional care has had its challenges.
Yeah, the access to PPE for hospice providers was limited, just like it was for everyone else. But our mission of making sure that people had end-of-life care available to them in our communities was very important to us.
So Nurse Ryan made it his mission to get what was needed.
And so not only did we work as an organization to make sure that we could garner all of the appropriate PPE to keep our team and our patients and their families safe, but also we reached out to the community and said, we're serving a mission and we need your help. And so we placed calls to auto body shops, to veterinary clinics, to dentist's office, anyone we knew would have the type of equipment we needed to stay safe so we could continue to serve our mission.
And he got it. But it's not just safety and protection that are a must for those in Nurse Ryan's world. It's also about bringing what he calls sunshine to those who need it now more than ever.
This little guy right here is Diddy, and he's a miniature horse. He's 2.5. And Lucy back here is a 4-year-old Mustang mare.
And they are quite the pair.
When I had a chance, I brought Lucy and Diddy out to say hello and do window visits. Many of the folks in those care settings were heavily secluded for a long time at the beginning of the pandemic, and I thought this was just a fun and easy way to bring some happiness to their day.
Bringing light and joy into what can be a dark moment in someone's life.
It is wonderful to see people's eyes light up and their grins get huge when they see the horses. And some of the areas where I went was more of a farming community and a rural area, and so you could tell it was a part of their life at some point and really meant a lot to see an animal.
And it's that genuine caring spirit, the heart to nurture, and the will and strength to do what is right by his patients and his team that make Ryan Klostermeyer a top nurse, a nurse who will be there for you no matter what. Charlotte Deleste, News 3 Now.
We'll have some final thoughts on the top nurses of 2020 when we come back.
Fearing's Audio-Video Security have a team of experts to guide you in choosing the right technology for your business and home. Then we custom design and install easy-to-use solutions to advance your business, enhance your home, and simplify your life. Check us out at fearings.com.
Burning the candle at both ends this holiday season? Well, if it's Z's you need, the holiday sale at Denver Mattress has you covered. Right now, get a $300 Furniture Row gift certificate with select Tempur-Pedic mattress sets. Or check out the budget-friendly Summit Queen, only $189.99. Shop our Doctor's Choice Original lineup starting at only $569.99. Plus 5 years no interest financing and free shipping right to your doorstep. The holiday sale on now at Denver Mattress.
Your business is your pride and joy. You raised it with hard work, from nothing but a dream. And since you care so much, naturally you want to protect it from harm. That's where we come in. Because a great insurance policy is not a necessary evil. It's the best way to keep your business happy, healthy, and profitable. And that is the silver lining. Pamper your business with a policy from West Bend.
Fearing's Audio-Video Security have a team of experts to guide you in choosing the right technology for your business and home. Then we custom design and install easy-to-use solutions to advance your business, enhance your home, and simplify your life. Check us out at fearings.com.
We've met some fantastic nurses tonight, and picking the top ones of the nearly 60 that were nominated is nearly impossible. This year, as our nurses have become essential workers, we'd like to introduce you to many more of them. Nurses that took on new responsibilities this year as healthcare workers in the midst of a global pandemic. A pandemic that was initially an unknown disease. Nurses that cared for needs of the homeless, and others who were nominated for going above and beyond the call of duty, facing unprecedented challenges. Are the faces we all owe immense gratitude toward, and a huge thank you. News 3 Now and Madison Magazine salute them all. They are the top nurses of 2020.